Brain cancer will kill more than 14,000 Americans this year. According to the Journal of Neuro-Oncology, more than 500,000 people nationwide are living with primary tumors of the brain and central nervous system. Physicians and researchers in Oklahoma are on the cutting edge of new therapies to diagnose and treat brain cancer, including an experimental treatment that could stop the deadliest form of the disease.
Dr. Riel Towner is a scientist at the Oklahoma Medical Research Foundation who knows just how deadly brain cancer can be.
In the United States, there's approximately about 20,000 individuals that are diagnosed with primary brain tumors every year. And unfortunately, about 80 to 90% of those will unfortunately die as a result of that disease. And their survival is usually no longer than a year and a half after diagnosis.
One of the deadliest forms of brain cancer is glioblastoma, which kills nearly everyone it strikes. Glioblastoma took the lives of former U.S. Senator Edward Kennedy, Oklahoma baseball star Bobby Mercer, and former 2nd District Congressman Mike Sinar. There is no cure, but the Stevenson Cancer Center, in collaboration with OMRF, is conducting clinical trials of an experimental drug that may stop the disease. It's called OKN-007.
007. It spells Bond.
A James Bond reference, and researchers believe it can be just as lethal to brain cancer as the British super spy is to enemy agents.
Shocking.
So what we found is that these particular compounds can reduce tumors and in many cases regress tumors down to almost nothing in the laboratory models.
Dr. Scott McMeekin with the Stevenson Cancer Center says the first phase of testing involves 13 patients diagnosed with glioblastoma. The patients are given varying doses of compounds known as nitrones to determine how much of the drug they can tolerate and whether the compounds are effective.
We start at a lower dose, then go to a medium dose, then go to a high dose, and each step along the way treat 3 patients and then ask the question, is this tolerable? Is the dose that we are administering by vein reach the bloodstream at a significant concentration?
Once doctors determine the safe dosage, they'll expand the trial to more patients to determine how effective the drug is at treating the tumors. Another discovery at OMRF holds promise for diagnosing patients afflicted with other forms of brain cancer. Towner and fellow OMRF researcher Dr. Jonathan Wren have developed a program that employs biomarkers to help physicians find and grade a particular type of brain tumor.
So one of the problems with looking at primary brain tumors that are very aggressive is trying to establish how aggressive they are and what sort of therapeutic options you would have for that particular tumor.
Dr. Wren developed a computer program called Global Microarray Meta-Analysis, or GAMMA, to find genes that interact with known cancer genes through a guilt by association approach.
If we don't know what the gene does, but we know what kind of a crowd it hangs out with, so to speak, then we can infer what the gene probably does. And so far in laboratory tests, it's been pretty accurate.
The genes are then used to create a list of possible biomarkers for cancer. The program will initially be used to diagnose tumors, but Wren believes the process might eventually lead to antibody therapy to target biomarkers, crippling the cancer's ability to grow.
If cancers are using a specific protein to communicate with other cancer cells and grow, to create more cancer cells, and we can interfere specifically with that process and not with normal cells, it's essentially a treatment for cancer.
Most current treatments for brain cancer involve surgery to remove the tumor, followed by radiation and chemotherapy. An Oklahoma City physician is using a relatively new approach known as Keyhole Surgery. Dr. Mike Shagru is a neurosurgeon at OU Medical Center in Oklahoma City.
What your goal to do is to provide the least destructive opening into the head to access the tumor and remove it. And that can be anywhere from a standard opening to something the size of a quarter.
Shagru says until recently, most neurosurgeons wanted as wide an opening as possible in the skull, which led to long hospital stays for patients. Using the new technique, patients can sometimes go home the day following surgery.
It shortens your recovery if your brain isn't exposed for several hours. But furthermore, my operative time is a lot less because I'm not spending my time doing a bunch of stuff that I don't need to do.
Shagru admits there is still some resistance to the procedure, especially among older neurosurgeons.
It takes a leap of faith Because the very first time you see a hole this big, you're trained as a neurosurgeon to think, wow, I don't have enough room. And I remember the first time I did one, I said, I don't know how we're going to get to work. When you know what you're doing, by the end of that operation, you feel like, I don't know how I would have thought that it wasn't possible. I have tons of room to work.
Shagru says he's performed about 700 keyhole surgeries in the past 2 years. He believes what is now a cutting-edge procedure will become the norm in brain cancer surgery within 15 years.